We all know that it is in people nature that we always want to improve ourselves, but very often we are not able to find out how to do it. And so Dr. Arijana Meštrović, our next speaker, will teach us how to do it. She is an assistant professor and independent consultant in Pharma Experts International Agency. She provides lectures and workshops in CPD programs for pharmacists, implementing new services in pharmacy chains, and teaching professional practice and pharmaceutical care at universities in Croatia and Cyprus.
And
here in a few moments.
To all the colleagues all around the world from Croatia. It's already evening here, and I'm very pleased and honored that I'm invited to present to you how we can achieve and develop competence in a pharmacy profession today. So the topic that you can see on the screen was actually the topic of my PhD. I was also a pharmacist, a community pharmacist for many years, and I was trying to develop my competences in different ways. But it was not always easy because I was not completely sure what is expected from me, and I was not aware of the guidelines which exist in the pharmacy world that I can maybe follow or learn from or maybe compare with. So during my PhD thesis, I was trying to learn about it. I was also in charge for the biggest pharmacy chain in Croatia at that time, and I had my own sample of pharmacists, which means that I could really enjoy the pleasure of researching in the workplace in a community pharmacist in my country. I would now like to see how can I move from my next to my next slide. That would be, I'm not sure how I can do it.
You can see the arrows on the bottom left corner. Can you see them?
Oh, that's right.
There are two arrows.
Thank you very much.
Yeah.
So the competence in a definition is actually the combination of what we know and what we have experienced so far. So you cannot say only the knowledge is a competence, because if you don't use it in a proper way, or if you didn't try it in certain situations, then you will not be able to show in your performance how competent you are. But there is again a third component of competence, which is extremely important, and that's your willingness to show what you know. It's your willingness to help to the patients. It's your willingness to combine your knowledge and your experience to the benefit of the patient who is in front of you. And it's extremely important to have a good attitude, the positive attitude, to explore, to show it in a certain situations in a different way, and to adjust your communication skills, your consultation skills, and your knowledge to the level of the patient which is in front of you, which is not always easy, because sometimes you can see around 200 patients per day in your community pharmacy. But anyway, it's the ability that we all have if we are willing or to try. So you can, of course, assess my knowledge if you give me any kind of test or any kind of survey or something like that. But if you really want to see how competent I am in my workplace, it would be better if you can come to my workplace, spend some time with me, and observe how do I perform my everyday tasks. How do I manage to solve the problems, to solve the issues, maybe some kind of the conflict that I'm facing with my patients or with my team, and also how do I organize my time, how do I organize my priorities, what is the level of my risk assessment to the decision-making process every day, and so on. So this is actually my picture many years ago with my colleague, and it's like a kind of assessment. So I came to her pharmacy, she was working, and we were trying to figure out together how competent she is according to the tasks that were waiting for her in her working day. But of course, we have to see the pharmacists in the different situations. It's not only dispensing, it's counseling the patients, then reading the leaflets, using evidence-based medicine sources, be good in the laboratory as well as part of our tradition, also provide screenings and health checkpoints to the patient if he is willing to share with us the status of the chronic disease that he has, and many, many other situations that you can face in the working day for the pharmacist. So how do we know what is the list of the competencies for the pharmacist today? There is a global document which is called Global Competency Framework. There are certain organizations behind them, such as FIP, Pharmaceutical International Federation, WHO, and UNESCO. And I was very lucky to be part of education development team who was working on the documents which one day finally became official list of the competencies in the world. Those little people that you can see here in the front page of the document are actually representing 64 different countries which were part of the validation of the document, which means that we can really say this is the global level, this is the global view of how competent and in which areas we should be competent today. And what does it say? It's not only pharmaceutical care or public health, it's also organization and management competences, which are part of the business model, as you can imagine. And also you have to be competent in personal and professional way, which means that you have to have developed communication skills, creativity, ethics, decision-making, teamwork, and other things which makes you a competent person, no matter what you do in your everyday life. Of course, if you can measure those competencies, you can make some interpretation of the results and you can try to improve yourself or your pharmacy or the whole organization. Even the national needs can be identified by such investigations. I hope that some of you who are watching this presentation are maybe familiar with so-called CPD cycle. This is actually the cycle of continuing professional development. It starts with reflection, as you can see. So when you think about what you need in your practice, then continues with some planning, what you can do about it, maybe some learning, and after some learning, you have to evaluate what did you learn before you go for the application part. After application part, when you spend some time in using your new knowledge and skills, it would be good to evaluate yourself again before you start another cycle of reflection, planning, learning, and so on. Again, it's good to record those things, and it's good to try to evaluate yourself always after learning and after application, which means that you probably should see some differences before your learning and after your learning. Because once you finish your faculty one day, it will be more than 40 years in front of you for practice and more than 40 years for you for learning, more learning, because the practice will change with the time. Be aware that you will never be competent in a certain area if you didn't try it. So wherever you can, find a good mentor, find a good colleague, find a good place when you will be engaged. If you are staying in the same level for many, many years, actually you're stepping back, you're just going back to the position that it's not anymore competent enough to provide the patient services as needed. This document, as we said, is describing the pharmacy competencies, but there is another one which describes what kind of education you should have to develop your competencies. Because once you know where you are, then you have to estimate your desired level, but how to achieve it, how to do it in the meantime, so you can really say, really, I have improved in a certain area. I'm very proud to be co-author of this scheme together with Mr. Michael Rouse, who is coming from Chicago, ACPE. And it says that if you really want a good quality of education, you should think first about the context. Think about what kind of education do I need in my context. If you live in Egypt, or if you live in Croatia, or if you live in Kuwait, or if you live in Afghanistan, those could be different contexts in your settings. Maybe also it's not always the same for the hospital or community, not the same for industry or, I don't know, marketing department. So it's about who you are, where you are, and what is around you. Then, of course, it's important to know what impact of education do you want to have. What do you want to achieve with this? This is extremely important. And in the meantime, it's very important to see the structure, the process, and the outcomes of the education. The structure should be well done, with lots of interactivity, with the good presenters, with their own experience, and also the outcomes should be measured. After every education, you should go and measure your outcomes before you achieve some impact. As well, you can see three foundations. Of course, the first one is a science. Everything what you learn, it's important that you are aware it's evidence-based, it's science-based, it's truth. It's not something that someone has just presented to you. Again, you would like to see some practical aspects of the education. And again, it should touch your values. It should touch your attitude. Some kind of ethical issues should be covered in the education. So if you fulfill all these 8 elements in the good educational process, you can be completely sure that there is a good chance for you to improve. Because science is a base for knowledge, practice is a base for skills and experience, and ethics is of course base for attitudes and values. And as we said at the beginning of the presentation, if you combine your knowledge and your experience with your willingness to change something in your patients, to do something, then you can show increased competences. Those kind of materials you can find in some published research. This is one of my early work that I published 4 years ago about the improvement, because we have actually measured the competencies. You can see those little dots. This was the competencies on the year 1, which were measured according to the Global Competency Framework. And after 1 year of education, we have achieved improvement. You can see that we have improved the most in the competencies that we were really poor at the beginning of investigations, especially counseling the patients, monitoring drug therapy, information about drugs, patient education, and monitoring of the treatment outcomes. So this was the statistics which shows if you have a good education between level 1 and level 2 of the competency, then you can achieve the improvement. Of course, this is your choice. Every day you are actually holding your knowledge in you. You are gaining some experience, but it's completely up to you. Are you going to use it, or are you just going to perform on the shallow level, like you don't care, like every day is just a routine for you, like you don't see a proper person in front of you? And this makes a big difference between performance of the pharmacist 1 and the pharmacist 2. Please be aware that what patients see is what they get. And this is actually the clear picture of how competent you are. Even one wrong move, one wrong sentence can really put the patient in a very difficult position not to trust you. And if the patient doesn't trust you, then the relationship between you is completely broken. Again, some clarity of standards, personal control, and professional duty is something which is significantly related to your responsibility about patient safety and the outcomes. And again, we need to be competent wherever we are, no matter if it's a hospital or technology department in the industry, or maybe research, or maybe teaching. Whatever we are doing, we should be competent in what we are doing, because we own that to the patients. We have talked a little bit about the basic competencies, but there are also some advanced competencies in your profession, which would be like some kind of specialization if you want to be an expert in a certain area, like, for example, phytotherapy or aromatherapy or medicine therapy management or those kind of things. Then you should build the good working relationships. You should be in a good network of experts around you. You should have a good leadership. You should be able to manage the therapy of your patient. Again, education, training, and development should be one of your biggest stars of your personality. Research and evaluation, quality assurance, and also working and learning together with other players in the healthcare system. So maybe you will remember the most if I tell you we are as much as competent as we are the masters of changes in our own environment. And when you remember any kind of expert about something, it's usually about some kind of change that the expert has achieved in his own environment. And very often they will say to you, it was not easy, people didn't accept it at the beginning, they didn't recognize it was a good thing. Think only about the famous composers or writers. In their time, they were not so popular. Only later, after they maybe even died, people recognized how big change it was, how important competence it was, and it was really, really important to remember. And now you can see all around the world the big sculptures and the pictures of the famous experts or artists who were not recognized at their time in their work. Also, if you are competent enough, you will be able to perform good patient care, and there are some indicators of quality that you can maybe look around and see Is it something that you can maybe test? For example, these are some important indicators which took place in the European level, like from the Council of Europe, and it's something that could test what you're actually doing in your everyday practice. One of the most famous processes that we are now employing in the pharmacies is the so-called pharmacist patient care process, and it tells you that you should collect some data from your patient, to assess some data about your patient, to plan some activities, to implement them, and finally to follow up and monitor. In the center should be your patient. You should collaborate, communicate, and document. This kind of principle I'm using with my students in Cyprus. You can see this is the little booklet. Those are my students in Cyprus, northern Cyprus. And as you can see, they are coming from different countries, from Syria, from Afghanistan, these guys from Pakistan, Turkey, and other countries, and they are working together. They are collecting the data in such very nice templates, and they actually understand very good how to do it. At the exam day, you can see the very happy and smiling faces of the students. All of them pass through the exam because it's a very logical process, and they like to imagine how it will be one day when they are really in practice. Again, this is one more model that you can think of in your future of education. So, for example, you first can start with your needs. Imagine in your country you have a local or national need. For example, you want to introduce the immunization in your country because there is a need. And then you can say, okay, what kind of services do we need? Okay, we need a service to provide the immunization in the pharmacy. And then you ask yourself, what kind of competencies do I need to provide that kind of service? And then you ask yourself, what kind of education would we need to achieve those competencies, to provide those services, to meet the needs of the country. So it's kind of reversing engineering, because you're not starting from the education like in many countries. You have a faculty of pharmacy, you go, maybe you achieve some competencies, maybe you provide some services, and not so likely that you will find appropriate that you have really addressed the needs of your country. But if you start with the needs, if you identify the services and competencies, then it's much more easy to start your education in a proper way. Also want to show you, this is a smart way to learn, reflect, to plan, to learn, and to evaluate, but much more smarter is if you can really apply. If you can go back to your working place, if you can apply your knowledge, and if you can see how it will change lives and lives of your patients. Those indicators in patient care are asking you many things. Are you educated enough? Are you performing your continuing professional development? Are you competent in the rational pharmacotherapy? What about the self-treatment? What about prevention and the public health? Can you provide control measurements and screening in your pharmacy? Are you, again, collaborating interprofessionally? And do you have the follow-up process in documenting of the patient care? And if you count your numbers, you can see if there is no implementation of the patient care. Is it a low level of implementation, medium, or hopefully fine, high level of the patient care in your pharmacy? These are some data from my country, from Croatia, from 2012 and 2016, and you can see those lines which are more lila are from 2012 and more blue are from 2016. If you're really focused in doing what you need to do, then all the indicators will grow. Education and CPD, rational pharmacotherapy, self-treatment, prevention and public health, and so on. So you can see the beautiful improvement in the different pharmacies. And we were at the 2012, it was between not implemented and low level, but in only 4 years, we have moved to the low level, to the medium level of the patient care. Of course, there are some details here in the presentation that you can see what does it actually mean to be well educated. So, for example, are you assessing your competencies? Are you having any specialization in any kind of clinical pharmacy? Do you have individual educational plan and portfolio for yourself so you can plan your learning accordingly? With the rational pharmacotherapy, again, are you collecting? Are you assessing? Are you planning? Are you following up the implementation, and are you putting the patient in the center? Again, in the self-treatment, there is also a risk that you don't recognize the situations when you need to set your patient to the doctor. So it's important that you recognize it's maybe risky situations, and it's not up to you to take over the management process of the medicines. Again, many public health campaigns, prevention, immunization, talking about health in non-pharmacological way is also a task of the pharmacist. As well, control measurements and screenings like point of care in the pharmacy. And don't forget about your colleagues, pharmacy technicians. They will be your partners in health. And don't forget that they can do many, many different important things for the patient while you are maybe busy with something else. Don't hesitate to pick up your phone and to call medical doctor, a nurse, a laboratory technician, nutritionist, physiotherapist, and other people who can really help your patient to achieve the fullness of the therapeutic goal and treatment. Follow-up and documentation is something that you will need if you really want to show someone how good you are in what you're doing, if you want to apply for the new job, if you want to travel internationally and maybe show what is your portfolio, what you have done over years. So if you didn't start yet, it's a good time. Maybe it's a new year very soon, so you can make your new year decision to open up a folder or the booklet or something like that and start to write down what did you done to improve yourself. This is one example from Turkey. I'm not sure if anyone is here from Turkey and maybe listening to me, but this kind of projects and education, you can see me here in this line. This is the Minister of Health in Turkey, and this is the Turkish Pharmacists Association Management Board. We have presented asthma services, and it was very impressed with the information that we have provided. So he even promised that he will start to pay for the services that pharmacists are providing. We have collected the data in such documents that we have developed. We have then measured the competencies at the beginning and indicators of quality and also at the end, and we have found out that we are actually part of the family of the pharmacists in different countries which are providing services. This is the European Association, which is called PGU, Pharmaceutical Groupation of European Union, and in the annual report of the last year, they showed how many countries in Europe are providing different services. Actually, how many countries are opening the possibility to engage the pharmacist to develop competencies in the patient care, which is extremely important. Don't think that you are going to be able to live from the products or from dispensing, because this time is completely over, no matter in which part of the world you will practice. Services are now the most important things that you should think about. Cognitive services, intellectual services, services connected with pharmacotherapy, and all other complementary services that you can provide in your pharmacy. You have to find a way, you have to find the time, you have to find motivation to start. Healthy business will depend on the number of the prescriptions and number of the purchase in the pharmacy, but again, it will also depend about your attitude. If you have a good attitude, the patient will recognize it and he will come again and again. Those are also some examples, for example, from Croatia, when we have one pharmacy chain in Dalmatia and Slavonia in only 3 months of the services, which was completely free to the patients, so they didn't take any money from the service, only providing the service. They have increased the number of patients, the number of prescriptions, the number of the purchases, and also the revenue growth yearly has increased from 8 to 15% according to the different places in the pharmacy. At the end, I want to remind you on the good pharmacy practice. I'm sure many of you have been introduced to the document, but you can see the old role of the pharmacist was to prepare, to acquire, to store, to secure, to distribute, to dispense the medicines. But today we have a new roles to manage the process of the therapy, to monitor the outcomes, to provide good information, to assess the health status, and even more, to educate ourselves and the patients as well, and to be actively involved in the actions of prevention and control treatment outcomes, to be connected with the national organizations, to support national strategies, and to educate the patients about medicines. So I hope that I will see you somewhere in the future. And I hope that you have a vision and mission to implement pharmaceutical care at the high level, not just the medium one or the low one. And actually, this is the call for each of you to join us to create the new face of pharmacy in the world, wherever you are, by showing your competence day by day when you're meeting your patients. And we still need to develop some things, that's true. So we have to be aware that competence is something to be assessed, to evaluate. We have to collaborate between us in the practice pharmacy profession and also outside the profession. We have to develop the culture of communication. We have to be aware that our services are very valuable, and we have to document those things. We have to focus on the important things, and we have to show ability, excellence, and trust, because we are proud to be a pharmacist. This is a noble profession, and we have to keep going in a very, very good way. So I hope that I didn't spend too much time in explaining. I was a little bit rushing because the conference was late, but I'm here to listen to your questions if you have them, or any comments. I would be very happy to provide. So thank you very much for listening. And although I cannot see you, I'm looking to your eyes right now and saying, be proud to be a pharmacist, develop yourself as much as you can.
Thank you, Arijana, for this amazing presentation. And so, as you said, we can start with the questions and answers. And in the chat bar, I see a question from Shifat. He asked, in my country, patient counseling for pharmacists is not very widespread. Any advices for pharmacy students as how to practice counseling before we enter the field of pharmacy?
Okay. You can start with your family members. This is the way I did it. I'm sure all of you have a father or mother or sister or neighbor who is needed to talk to you. And you already have a good knowledge. You already have a good sense about what is important. So start to collect data. You have seen the patient care process. Collect as much as you can. Think, assess as much as you can, and try to make the small plan, short-term plans for
Thank
your
you.
family, and follow up the progress. It will give you very, very
Yeah,
good
you
courage
definitely deserve
one
it.
day to be prepared.
I also have one question. First of all, I want to congratulate to you and to whole pharma expert for this amazing job that you are making. But I would like to ask you, I believe that this kind of education is very important, and I would like to see it more implemented in the high education, in the academic circles, in faculties. So I would like to ask you, what is your vision for that? What are the outcomes from the faculties? What are the professors at the faculties thinking about this kind of education, and are they planning to implement it in the future?
Look, we must hope, and we have some good examples from some countries. Some of the countries, like for example UK, like America, like Australia, they are opening the faculty buildings and faculty hearts and faculty brains to the practice, which is extremely important. They're also allowing people from practice to come back to academia and to teach, because I think only together with science, practice, and ethics that we can achieve it. So we must not stop believing those things. And I think the changes are already here. They're slow, but it depends about us. I can tell you from my own experience, I was invited many times, as today, to just break up my schedule and be together with the students. I think it's very, very important. And I like the opportunities like this, because you never know, even your one sentence or one experience that you have can change someone's attitude. And as I'm reading now the compliments here, and mainly people are talking about inspiration, and that's very, very important, because even in the pharmacy practitioners, I see today.
Thank you for a great answer. So, if there is anyone else wanting to ask something. Seems like we don't have anyone else. Again, I would like to thank you for this amazing presentation. we will now go on to make a short coffee break, virtual coffee break, all of us before the next lecture, and
That's very good.
it might be. Well, we are connected for 2.5 hours, so I think it is a nice time for a little stuff.
So I think the coffee is a good idea. I'm sure. Yeah, I'm sure it's good.
Bye bye.
Thank you very much for the inspirational opportunity for me, and I wish you all the best with the Congress, and
so
congratulations.
I'm here again. I think that you can hear me. We are now going for a little coffee break, and we'll be back here at 7:50 with the lecture delivered by Justina Skovira, who will speak about three-dimensional printing in pharmacy. So don't miss it, be here on time, and see you virtually in 24 minutes. Bye bye.